Hello, my name is Christina Figueroa, and my chosen facilitation technique is mindfulness. While a modality of recreation therapy, mindfulness tends to have a stronger focus on psychological, cognitive, and spiritual well-being when compared to other modalities such as adventure therapy and Tai Chi. As Carthers and Hood expressed in 2013, mindfulness proposes an impactful type of intervention that can be used by therapeutic recreation specialists to help clients fill their lives with meaning, personal growth, and positive emotion. So, what exactly is mindfulness? What does it entail? The definition is a bit difficult to pinpoint due to the various terms and methods associated with the facilitation technique. That being said, the general consensus is mindfulness, as depicted by Kabat-Zinn in 2003, is the state of open awareness that comes from the acceptance of intentional and non-judgmental attention to the unfolding of present moment-to-moment external and internal experiences, such as sensations, emotions, thoughts, and perceptions. Mindfulness practice may also include various types of meditation, such as formal, informal, and moving, as well as cognitive behavioral therapies that focus on mindfulness techniques. The defining characteristics of mindfulness are intention, which is the recognition of dedication and identification of why someone is practicing, attention, or the focus brought to all experiences, and attitude, which showcases exactly how to pay mind to everyday experiences. The history of mindfulness holds its origins in Eastern philosophies, such as Hinduism and Buddhism. Such religions emphasized serious, enlightening reflection within oneself, to realize worldly detachment, and to ultimately achieve nirvana. Such traditions were motivated by the concept of dukkha, or suffering. Dukkha encompasses emotions and habits that are believed to lead to worldly suffering, which allows the cycle of reincarnation to continue for an individual who does not practice detachment of any kind. Unless that individual were to practice detachment and ultimately achieve nirvana, that individual unfortunately cannot break the cycle of reincarnation. Such individuals typically believe the world will provide them all the happiness they need through worldly possessions, money, and other material pleasures. This, to Hinduism and Buddhism, is an untrained mind. So they practice mindfulness to reduce dukkha and to cultivate a stronger, sounder mind, a clearer heart, and more righteous action done unto others. It wasn't long before Westerners' interest was piqued in the 1960s, but it wasn't until the 1970s that mindfulness was introduced into psychotherapy and began to present itself as a universal practice rather than a practice exclusive to Buddhist philosophy. Today, an insurmountable number of mindfulness practices are rampant throughout the West. In fact, over hundreds of millions of practitioners practice meditation. Mindfulness practices are everywhere in the forms of yoga, Tai Chi, dedicated meditation centers, and more. Even in today's more social society, if you were to look on an Apple Store or a Google Play Store, you would see plenty of different meditation apps, such as Headspace, Calm, and the like. Looking over at YouTube, you'll see a plethora of videos and YouTube channels and playlists having dedicated yoga sessions to reduce anxiety, reduce stress, create calm feelings, relaxation, and even better sleep. It's no doubt that the entire world sees the benefits of meditation and mindfulness-based practices, especially considering its popularity and its multitude of benefits. Speaking of popularity and effectiveness, over 30 years ago, the University of Massachusetts Medical Center introduced a stress reduction program for those who suffer from chronic pain. The stress reduction and relaxation program lasted 10 weeks and focused on patients practicing mindfulness meditation in an attempt to self-regulate their pain. By the 10 weeks, 65% of patients saw a 33% or less reduction in pain, while 50% showed a reduction in pain of at or over 50%. Mindfulness interventions also show great therapeutic benefits for those part of the mental health population. In a study by Godfrin and von Heeringen, mindfulness-based cognitive therapy was used to see the effects it had on preventing future relapse or recurrence of depression in patients with a history of depression. After conducting a 56-week study period, results showed a significantly reduced amount of time between the beginning of the study and the first relapse or recurrence, as well as a noticeable reduction in both short and longer-term depressive moods, and an increase in better moods and quality of life. Finally, Speck, von Ham, and Niklasek conducted a randomized controlled trial of mindfulness-based therapy in adults with autism spectrum disorder. Throughout the 9-week trial, the intervention group showed a great reduction in anxiety, depression, and rumination. Additionally, the intervention group saw an increase in positivity. While mindfulness is highly regarded as one of the best practices for stress reduction and positive effects in those with depression, anxiety, and other disorders, why it has such a positive effects is yet to be fully understood. That being said, Carruthers and Hood attribute mindfulness-based practices' positive benefits to the increase of positive emotions, reduction of stress, and increased desire to pursue what one most cherishes in one's life. Mindfulness exercises have a tendency to use the parts of the brain that activate when a positive effect occurs, so when one practices mindfulness techniques every single day, the brain gets into the routine of experiencing positivity. This encourages a more positive disposition overall, adding to positive emotion, our personal growth, and the cultivation of one's own strengths. Not only does mindfulness produce feelings of positivity, but it also helps contribute to the development of cognitive, physical, emotional, and spiritual acts of one's being, which ends up becoming one's strengths. Furthermore, this allows one to become more accepting and open to life in general, due to open awareness of each and every moment and the level of intimacy one will experience with one's character. According to our textbook, this also contributes to better management of negative experiences or life crises. From releasing ruminations to learning positive coping mechanisms, mindfulness sets the stage for positive emotion on all levels and stages of life. Not only does mindfulness enhance positive emotion, but it also reduces the negative effects of anxiety, dysmorphia, depression, and negative habitual coping, by allowing the client to both openly and willingly accept negative experiences as much as positive ones. Instead of teaching avoidance to things that make the client feel negative emotions, mindfulness practices instead teach the client to experience all of reality as it comes and as it goes, without attaching any type of personal spin on it or overreaction. This allows the client to not cower away when a negative emotion pops up, but to instead simply observe it and make note of the negative occurrence. Such a response to otherwise unideal events cultivates acceptance, gentleness, and compassion throughout every moment of life. What's more, this removes the attachment a client may feel to his or her assumptions about a situation, such as anxious thoughts about a certain life event that just took place. The client will go from jumping to believing the intrusive thoughts to thinking clearly and allowing a moment to be just that, a moment. The facilitation technique I chose to focus on is meditation. There are 4 different types of meditation. There's formal meditation, informal meditation, moving meditation, and mindful walk meditation. The first of the 4 is formal meditation, which can be done by sitting down, being guided, or walking. Now, formal meditation is normally categorized as a brief daily practice that takes you away from your daily activities for just a moment so you can focus on your breathing and focus on whatever you decide to meditate. So in this case, we're going to practice a technique called 4-7-8 breathing, which is a very common and effective technique. So I have my client here, relaxed and sitting in a nice posture. And the way you direct this activity is the client is going to breathe in through their nose for a count of 4, hold their breath for a count of 7, and slowly exhale the air through the mouth for a count of 8. So let's do this together. You ready? So nice comfortable position. Inhale through the nose. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Now exhale through the mouth. 2, 3, 4, 5, 6, 7, 8. And repeat. Count in your head. Now this technique is important to know that you breathe through the belly. Unfortunately, a lot of people breathe through the chest. So when they take a nice deep breath, they puff out their chest. They bring all their air to the top part of their body. And that's not how humans should breathe. The correct way to breathe is through the belly. You're supposed to breathe in and push your diaphragm down so that where your lungs can expand and achieve the biggest breath they can possible. And then when you exhale, your diaphragm helps push all that air out as well. So be sure to tell your clients how to breathe through their belly as opposed to the chest before you begin the meditation. This also gives clients another thing to focus on if they're having trouble focusing on 4, 7, 8 counting. So in the beginning, meditation is a little bit difficult for people to grasp because they're not used to just sitting down and thinking about nothing but their breath, especially in this society when everything is go, go, go. So it's best to start with just 5 minutes of guided 4, 7, 8 breathing. Encourage the client to practice this for 5 minutes out of their day, just 4, 7, 8 breathing. Breathing in for 4, holding for 7, and breathing out for 8. You can start with 5 minutes daily practice for the first week. If the client is comfortable, you can move up to 7, and then after the next week, you can do 10, and you can work all the way up to 30 minutes of 4, 7, 8 breathing. By this time, the client has a bigger grasp on how exactly to meditate and how exactly to breathe for the best possible meditation they can receive. The mindful walk is another type of moving meditation, which can help a patient or client attune to the environment, nature, weather, what it feels like to be outdoors, what it feels like to walk, to connect to the present moment, and feel awareness of surroundings. So when implementing the nature walk with a client, it is extremely important to emphasize the fact that the client should be looking around and drinking in their surroundings, between looking at the sunshine through the leaves, or seeing the texture on the branches, feeling the climate, maybe seeing a butterfly or a blue snow crab like we have here in Secret Woods. It's important that they pay attention to as many details as possible to distract them from the potential depressive or anxious thoughts that they might be experiencing. It's also important that they learn to stay in the moment, stay grounded, which is why nature walks are so important. There's always so much scenery and so much going on that they can take in, and whenever they experience a depressive episode or an anxious episode, they can always think back to when they were in nature, or even go to their local park and practice the mindful walk that was implemented during therapy. A crucial part of nature walks is equipment. When venturing through the great outdoors, it's important to be prepared. Clients should be advised to wear comfortable, closed-toed shoes, such as sneakers, and light, breathable clothing that makes movement easy, such as gym shorts, leggings, or dry-fit t-shirts. A hat and sunglasses are optional, but highly encouraged, especially when a nature walk will take place in a park without much shade. The most important piece of equipment of all is a water bottle. Hydration is key regardless of what activity you're doing. Clients should also be encouraged to bring sunscreen and bug spray as to have the most positive experience possible. If a client experiences difficulties walking, be sure to visit a park with handicap ramps, wheelchair accessible parking, and wheelchair or walker accessible paths.